But you also have another force called blood colloid osmotic pressure, BCOP. And this is pretty much identical to the BCOP we talked about earlier. So earlier in the semester. So let's look at the glomerulus and filtration again. So what we have here are the blood vessels. Now what happens is like the blood vessels we call a glomerulus is going to filter out water and solutes and make filtrate. Now it's going to filter out water. Water is small enough, and due to the high glomerular hydrostatic pressure, it's going to filter water between the endothelial cells and the pedicels of those podocytes. Now things like red blood cells. So what do you notice about this red blood cell? It's pretty big, right? And remember, like capillaries, they're about the same size and diameter as a red blood cell. Now in this image, let's ask the chat, do you think this red blood cell will filter from the blood into the filtrate? So will it filter? Yes or no? Red blood cells are too big to filter through into the filtrate. So in a healthy kidney, you should not see red blood cells. That's why red blood cells in your urine is kind of a big warning sign. Now here we have a white blood cells. Do you think the white blood cell will filter through? Will it filter a white blood cell? Yeah, I'll just do it. Yeah, it won't filter through. They're too big. But yeah, only with infection. They can squeeze, but yeah, diapedesis, yeah, they don't do it under normal condition. Now platelets, should they filter through? They shouldn't filter through either. Again, look, they're pretty big. Even though they're smallest of the formed elements, like you don't want platelets and clotting factors ending up in your filtrate and causing clots in your nephrons. So platelets, they don't filter through either. All right, so then now here we have, actually I've made them way too big for, like, I'm not really to scale, because like if I drew ions, you wouldn't really be able to see them in this picture. So here we have sodium ions, chloride ions, and potassium ions, and calcium ions. Now, based on this picture, do you think that ions will filter through? Yes or no? So all of these are water soluble, especially since they have charges, but will ions filter through? Yeah, ions filter through very easily, because like these, even though big cells can't pass through the filtration slits and through the endothelial cells, ions have an easy time passing from blood to filtrate. Now, how about small molecules and solutes like glucose? Do you think it'll filter through? Yes or no? Yep, so a lot of you are saying yes. So things like solutes, like small solutes like glucose, and even other small macromolecules like amino acids, they can filter through as well. And then albumins. So here we have a protein, but it's a large protein. Do you think this large protein will filter through? Yes or no? Yeah, albumins do not filter through. They're very large proteins and they have a hard time they should not normally filter through into your filtrate of your urine. That's why if you have albumins in your urine, it could be a sign. Some people, they do have what we call protein spillover into their urine, but things like albumins, they should not filter through. All right, so what filters through? Water, definitely. Formed elements, cells, not in normal conditions, especially white cells. Yeah, like someone mentioned in chat, it can in terms of infections, but under normal healthy conditions, it should not. And definitely not red blood cells or platelets. And then ions, they do filter through. They're very small. They're very water soluble. Glucose and small sugars, yes, they should filter through. Larger molecules, no, and most proteins, they do not filter through as well. But definitely serum albumin, a very huge protein, and again, a big component of your blood proteins, they should not filter through. And why am I making a big deal about what filters through? Well, this is related to our blood colloid osmotic pressure. And again, we did cover this a little earlier, but I'll review. So with blood oncotic pressure, so oncotic pressure is like osmosis, but it's due to protein. So here we have the blood inside the glomerulus, and here we have the filtrate inside the capsule. So we have water molecules here, and we have all these serum albumins. As we established in the previous slides, serum albumins should not filter through from your blood into the capsule. Yep. So what happens here is that water will be attracted to by this blood oncotic pressure. And so remember, like the serum albumins, even in your regular capillaries throughout your or peripheral capillaries throughout your body, serum albumins are very attractive to water, so they're going to try to draw water back into your blood. That's why if your serum albumins were filtering through, your blood would lose the ability to have this oncotic pressure, not only in your kidneys, but all throughout your body as well. So that's why it's very important that these serum albumins stay in your blood so your blood retains its ability to hold on to water and reabsorb it. So osmosis, as a that classic definition, the movement of water through a semi-permeable membrane. And semi-permeable, why? Well, it allows things like water, ions, small solids through, but doesn't allow everything through. So again, it doesn't allow large molecules or serum albumins through and cells. So water, so again, it moves either from two ways of thinking of it. Water moves from high concentrations of water to low concentrations of water, or the way I think of it is like it moves to water is very attracted to things like ions and glucose and charged particles. So if you have a higher solute concentration, it's going to draw water toward the side that has a higher concentration of water. Just like I think of it like, was it like if you've eaten cotton candy here in Hawaii and then carried it around the state fair, it's going to attract water and humidity from the air, and it's going to get all sticky and have all these beads of water on it. So I like to think that sugars, salts, albumins, they all hold on to water. They are very attractive to water. So oncotic pressure is going to, again, your serum albumins should not filter through from your capillaries into either Bowman's capsule. So what's going to happen is that these serum albumins, these are going to draw water back into your capillaries. So this is reabsorption. So water is moving back into the blood vessels. All right, so then what happens here is that, again, we have our capillary and a capsule, and what we have are, well, we covered three of the three forces that affect the movement of water at the renal corpuscle. So we have glomerular hydrostatic pressure, which is going to push from the glomerulus into the capsule. Then this is being countered by the forces of the water that already is, or the fluid that's already in the capsule, and pushing back. So this is the capsular hydrostatic pressure. So if you ever get confused on which is which, so whatever types of hydrostatic pressure, if it's the glomerulus, the part that's before hydrostatic pressure, that's your starting point. So glomerular hydrostatic pressure starts in the glomerulus, ends up in the surroundings. Capsular hydrostatic pressure starts in the capsule, ends up in the other spaces that it can go into, namely the glomerulus. Then we have our blood colloid osmotic pressure, which is due mostly to the serum albumins. And again, just like the B cop in your other capillaries in your body, is going to reabsorb water back into your glomerulus. Now, is there a capsular hydrostatic or capsular colloid osmotic pressure? Well, this is why it's very important to know that serum albumin should stay where they are, because is there a capsular or is there a C-cop? Is there, well, thing is that, what's driving B-cop? Those serum albumins, right? So there should not be a C-cop, right? Because again, the serum albumins should stay where they are. How can you get serum albumins into your filtrate? Well, say you ingest a very or your body produces, or say you ingest something that's very toxic or a toxicant that damages the cells that line your kidneys and at the glomerulus. Well, if these cells start to die and create these large openings, what can happen if you start to damage your blood vessels and your kidneys? Well, now without these capillaries intact and these podocytes intact, now these are bigger slits that these albumins and large particles can filter through. So this might be one way that you can end up with albumin in your filtrate, is if something damages the cells that are in your kidneys. So if you're damaging that, so that means that, again, that's why albumins should not end up typically in your filtrate. Typically, if you have serum albumins in your filtrate, that means something has damaged your kidneys at the cellular level. And yeah, so things like toxic metabolites. And what I showed here is actually a toxic metabolite of aspirin. But it's not just aspirin. Many other drugs can cause toxic metabolites, and if you keep on accumulating toxic drugs that attack your and cause cell death in your body, yeah, that's one of the things. Especially if they have some, or that might be a little advanced, but sometimes sometimes drugs, when they're metabolized and changed chemically by your body, sometimes they affect different organs differently. Like some drugs, they generate metabolites that affect the liver more. Some generate metabolites that affect the kidneys. Some drugs generate metabolites that affect both and cause cell death in that. So that's also why they measure levels of kidney when they do blood work. If you ever had any sort of blood tests, they often measure enzymes that are normally found within the cells of your liver, those hepatocytes, and also enzymes that are found in the kidneys as well. So if there are enzymes that are being ended up in your blood or filtrate that should be in your intact cells, that might mean these cells are being attacked and dying and popping and releasing their contents into the fluids of your body. And that might indicate poor health. Yeah. So this is why they say when they have the recommended dose, that's the dose where even though you're generating these metabolites, your body is able to get rid of them faster than they can accumulate. But if you take too many of them, like my uncle, who pops aspirin like candy, which I'm very worried for his liver. But yeah, the thing is, like, if you start to generate these metabolites that are toxic at a bigger rate than you can clear them from your body, that's when you start to see health problems. All right, so then back to capsular hydrocolloid, or that CCOP. So is there a CCOP? So the thing is that it's usually negligible. Why? Because your albumin should stay in your bloodstream. It should not end up in your capsule. So this is why in healthy people, CCOP is usually 0.